The way to change those attitudes is in part by empowering people with disabilities to tap into their own very high value, by for the rest of us to listen to their experiences, their aspirations, their needs, and also by setting clear expectations of government, service providers and leaders to respond to those needs through high quality, inclusive, accessible services. And this is really why Australia is so pleased to be partnering with UNFPA, Women Enabled International and Pacific Disability Forum to assess and address barriers to women and girls' access to essential services, to make clear recommendations to address the key barriers, whether they're legal, policy, social, attitudinal, physical, communication barriers. All of these need to be identified and addressed if we're going to be truly successful. So today's event is a really important step. We do have a lot to do, but it's only by working together, government, civil society, private sector, people with disabilities and representative organisations, that we can take forward the recommendations these reports are making to ensure quality, inclusive services and information for everyone and lead to real change in the lives of women and girls. So to thank everybody here.
Thank you so much, Sally, for those opening remarks and really helping us to set the scene about the importance of understanding the needs of women and girls with disabilities and really being accountable to them and working with them to deliver the services that they need. Next, I would like to invite Yuri Kato, our new UNFPA Pacific representative, to give opening remarks. But before I do that, I'd also like to share a little bit about his bio. Yuri Kato is the director and representative of the United Nations Population Fund here in the Pacific, a position that he just assumed here in August. So we're very happy to have our new director on board with us. Mr. Kato has spent the last 20 years working in UNDP, IOM, and UNFPA. He has previously worked as UNFPA's representative for the Philippines from 2018 to 2020 until he was seconded to the International Organization for Migration headquarters in Geneva as a senior regional advisor to the Director General for the Asia Pacific. Prior to joining IOM, he was the representative for UNFPA in the Philippines and the deputy representative for UNFPA in Bangladesh, where he also served as representative AI and spearheaded the startup and scale-up of UNFPA's humanitarian response to the Rohingya refugee crisis. Prior to joining UNFPA, Mr. Kato worked as a UN Regional Coordination Specialist at the UNDG Asia Pacific Secretariat in Bangkok. He has also worked for UNDP in various capacities, including as Assistant Representative for Lao PDR, the Special Assistant to the Regional Director for the Asia Pacific. Prior to joining the UN, Yuri worked as a newspaper writer and editor in his home country of Japan. He holds a master's degree in international affairs from Columbia University School of International and Public Affairs. So I'd like to give a warm welcome to Yuri, and please share your opening remarks.
Ms. Abdullah, good morning to all of you. I'm a little embarrassed with the extensive introduction by Kathy, which I appreciate. But again, my name is Yuri Kato. I'm the new director of the United Nations Population Fund for the Pacific. And it's a great honor for me to be here on behalf of UNFPA, joining our co-organizers of today's event, the Women Enabled International, represented by their Deputy Director, Ms. Susanna Phillips, and the Pacific Disability Forum, led by Executive Director, Ms. Aseta Magrawai, in welcoming all of you in this room, and also those joining us online from across the Pacific to this launch of this groundbreaking needs assessment reports that highlight the barriers that women and young people with disability in Fiji, Samoa, and in Vanuatu encounter when accessing a service related to sexual and reproductive health and gender-based violence. On behalf of UNFPA, I'd like to first express our sincere gratitude to our dear friend from the Government of Australia, Ms. Sally Mackay, Assistant Director of the Global Health Policy Branch of the Australia's Department of Foreign Affairs and Trade, because without the very generous support from the Government of Australia to UNFPA Pacific's flagship program of transformative agenda, the very important research and the reports that we're going to discuss today would not have been made available. So thank you very much, Sally. I am sure you see me, and also our appreciation to all the other colleagues from DFAT posts who are joining us today online and perhaps in this room too. 15 to 17% of the total populations of the Pacific Island countries are considered people with disability. And 193,000 among them are young people between the age of 15 and 24. In this context, we are encouraged by the fact that as many as 11 Pacific Island foreign countries have already ratified the Convention on the Rights of Persons with Disabilities that recognize reproductive rights which is the first universal human rights treaty that mentions sexual reproductive health. And these countries are Australia, Cook Island, Fiji, Kiribati, Nauru, New Zealand, Palau, Papua New Guinea, Republic of Marshall Islands, Tuvalu, and Vanuatu. Another 4 Pacific countries have also signed the convention with the intention to ratify it, namely Federal States of Micronesia, Samoa, Solomon Islands, and Tonga. The reports that we launched today are a significant contribution to the member states, as we have only 8 years left till the target year of Agenda 2030, including SDGs, with a slogan of leaving no one behind. And the recommendations from the reports point exactly to what more can and should be done if to leave no one behind. It was already more than 30 years ago when American Professor Kimberly Crenshaw of Columbia Law School and UCLA put forward this famous concept of intersectionality in order to truly understand the others' discrimination and vulnerabilities in a comprehensive manner. And the reports in front of you are another important testimony and reminder of the intersectionality and correlation between disabilities and reduced opportunities for income, livelihoods, access to education and health services, and increased exclusion. And when it comes to sexual and reproductive health and reproductive rights and freedom from physical and sexual violence, persons with disabilities unfortunately experience even more severe discrimination and risks compared to their counterparts who are without disabilities, as Ms. Mackay just discussed as well. What I particularly appreciated about these assessments was also, as Sally just said, was the reports had included first-hand personal testimonies and statements. For example, a woman with a physical disability is quoted. She said, "I am sure that if information regarding what is available in the justice system is made available to all people with disabilities and their families, people with disabilities would come forward to file reports of their sexual abuse or violence that is happening to them." Along with these kinds of testimonies, these reports in front of you have identified specific gaps in legal and policy support, health and social protection services, especially for the disabled women and youth on one hand, and also highlighted societal and attitudinal barriers faced by people with disability at the community level on a daily basis on the other hand. And this is why UNFPA, working with the Women Enabled International and the Pacific Disability Forum in our Transformative Agenda program funded by the Government of Australia, is adopting a so-called twin track approach, trying to further develop the capacities of the duty bearers to implement the disability inclusion into the national reproductive, maternal, neonatal, child, and adolescent health programs, and also work on the social norm transformation through behavioral change communications. Once again, I'd like to thank all the participants here, in addition to the impressive list of all speakers and panelists, and look forward to the outcome of today's discussion so that we as UNFPA also can continue to do all we can in our control to help the Pacific Island countries to reflect on the report's recommendations and implement those so that we can jointly create, embrace, and cherish a more inclusive society where especially women, young people with disabilities in the Pacific region can feel more empowered so as to make decisions about their own body, their sexual reproductive health and reproductive rights, and enjoy lives without the